Okay, thank you very much, Olivier. Thank you to the panel. Thank you to the audience whom I don't see. Thank you to the Amadeus Institute for giving me the opportunity to make my case and why it is important to have a composite indicator that measures the performance of health within the overall composite indicator of attractiveness and stability of Africa. That's because according to Smith, and this is a paper that is now very old from 2002, it summarizes, a composite indicator summarizes multi-dimensional issues. It's going to be easier to interpret. We would be having the opportunity to rank the countries. We will have the opportunity to look at the progress of countries over time. We will be able to speak to ordinary citizens and communicate in very simple terms, and it can promote accountability of ministers of health in the countries. Now, the four main domains will be prevention, treatment, governance, research, and innovation. Let me start by the prevention domain. And here I would like just to share my screen because it would allow you to follow with me very easily. Yeah. Could you see, please?
Yes, we can see it.
Wonderful. So this is the prevention domain, and it's domain number 1. Okay, I am just for this domain, I will speak about how we can evaluate the performance during a pandemic and in normal times, outside of a pandemic. Just for this one. For the other ones, there will be just one slide per domain. And remember, it's a 4x4. So number 1, prevention domain. Any country during a pandemic, its performance during a pandemic needs to be evaluated by its ability to test and trace, its ability to manufacture locally, its ability to set in place virology and genomic capabilities. And let me emphasize these genomic capabilities because there is a huge diversity that in terms of African genetics that is ignored in the research by the West. And the African countries, if they gather this information about genomics, they would be able to enter by the big, not by the window, but the big door, the world of global research when it comes to negotiating with international institutions. The third subdomain is the existence of an effective and independent national center of disease prevention and epidemiology. And we know that there is, the continent is lacking epidemiologists. So here we need to collaborate by building networks intercontinentally and internationally. Last, for the prevention domain, we need to assess the efficiency of response to all these 3 strategies. It's good to have a national center, it's good to have capabilities, but we need to understand whether our strategies are efficient or not during a pandemic. Outside of a pandemic period, we need to assess countries by their abilities to prevent by looking at life expectancy at birth as the first subdomain, by looking at the maternal and infant mortality, and then by looking at the rate of survival from non-communicable diseases, and by their ability to screen and put in place vaccination programs. And let me just state regarding the 4th subdomain, which is the screening and vaccination, it's a very cost-effective approach, and we could leverage just the international aid and implement it properly, and we will see clearly a drop in the rates. Now, I have put in blue somehow the first and the second subdomains. I put them separately. If you look up in the slide, there is one author that has been published very recently, Sadeghi. He has squeezed my first and second subdomain, the life expectancy and the maternal infant, in one subdomain. But I have preferred to split them, and the reason is that since the 50s, we have seen a very good improvement in terms of life expectancies in Africa, moving from the 47 years or 50 years up to over 70s. But we still see very scary infant mortalities across the continent. And the reason is just because we haven't spent much money per capita to increase that subdomain. Let me move to my second main domain. Remember again, it's a 4x4 approach. So my second domain is the treatment, and how can we assess the performance in terms of treatment in a country? We look at the number of medical resources, physicians, nurses, technicians, midwives per capita. Okay, and Morocco is not doing very well in this regard, and the migration doesn't help neither. The other subdomain that is important is the primary health care. North Africa, when you compare it to Sub-Saharan Africa or to the South, is not very well in establishing a primary health care, and mainly a community-based primary health care. It's a concept that is not very well known for some reason. So we need to establish this one. It is essential for equitable access and cost-effective healthcare. And we need to have a coordination with the bigger national centers by measuring the referrals, for example. The third subdomain would be the responsiveness and the outcomes. Responsiveness, very easy, measured by the waiting times. The outcomes could be measured by the survival after discharge following a hospitalization. The fourth one would be to measure the health economics of the treatment. It doesn't make sense to provide a high cost treatment with low quality or high quality with high cost. We need to find a trade-off between cost and quality. Let me move to the third and before last main domain. This is the governance, and this is the backbone of everything. The coverage. Universal health coverage is something that is top priority for the for African continent, because it improves not only the life expectancy, but also the healthy life expectancy, which is measured by the DALYs for the experts. The problem, as mentioned by Dr. Muqaddam and by Emmanuel, is the informal sector, that we are unable to collect taxes. Not only we need to look at the coverage, but we need to look at the second subdomain, which is the ratio between the coverage and the out-of-pocket. I mentioned earlier in the presentation that there is a very high out-of-pocket cost to the household. This measures really the financial burden by patients, and we know through research that, excuse me, countries that have an out-of-pocket share which is superior to 50% are have poorer health financing performance. So we need to lower the out-of-pocket. Then we move to the financing of healthcare. Crucial, this third subdomain. We need to find the right mix between public and private. Yes, public expenditure is very important in installing the setting up the universal coverage, but the private sector needs to be part of this, and we need to target at least a 30% share of the private sector in the financing of healthcare. Finally, equity in access to healthcare, affordability of prices, and dignity while we provide quality care to people. And my last domain is a game-changing one, and I join Emmanuel on this, research and innovation domain. We need to increase the percentage of the national research budget, at least to 2%. We're not going to be at the same page than the OECD countries, but we cannot have something like lower than 1% and pretend that we are going to do innovation. There is no innovation with such percentage. We need to increase the number of patents per year. So we need to see more PhDs and doctorants per capita per year. And particularly these people, these future entrepreneurs need to be connected to an entrepreneurial entrepreneurial ecosystem with incubators, accelerators. They need to have access to capital, and not capital once a startup is already set, but a capital which is the seed financing, not to be able to overcome the valley of death. And we need to have a good proportion of women entrepreneurs, meaning that women need to have access to capital as well. So this is my last slide, and I think that the year 2020 will be remembered as the year of COVID, but it's the year of perhaps a great reset in terms of global health and in terms of the future of health and healthcare.
Thank you, Dr. Albiati. That's a very crystal clear presentation you offered, and